This is another edition of the Ministry of Health Week in Review. Here is a recap of our activities over the last few days. On Friday, August 23rd, the Ministry of Health hosted a farewell ceremony for work-study students from some secondary schools who spent several weeks understudying a number of staff in various departments of the ministry. The students received a ceremonial send-off interacting with the Human Resource Manager, Tamika Noel, Principal Personnel Officer, Mohan Ramratan, Georgel Abrams, Senior Health Education Officer, and other senior officers within the ministry, including Vishnu Tolaram from the Ministry of Labor. As part of the ceremony, the students were awarded certificates of participation from the ministry's personnel department. Honorable Minister of Health Dr. Frank Anthony, in his brief address, extended his best wishes to the students for their future pursuits and urged them to consider careers in healthcare. He pointed out that the Ministry of Health offers 20 different training opportunities, including pharmacists, nursing assistants, medics training, and several others. On Saturday, August 24th, the Honorable Minister of Health, Dr. Frank Anthony, visited Better Hope Health Center as the eye testing and spectacles voucher distribution program was rolled out. During the visit, Minister Anthony engaged with several residents who expressed their gratitude for both the vouchers and the convenience of having the service delivered directly to them. Several private applicants were on ground providing services for those eligible. On the said day, Honorable Minister of Health Dr. Frank Anthony attended the annual award and bursary ceremony hosted by the Guyana Nursing Association. With 96 years of service, the ceremony recognized 13 nurses from across Guyana who received awards in various categories. In congratulating the Guyana Nursing Association on achieving 96 years of service, the Minister of Health, Honorable Dr. Frank Anthony, emphasized the importance of preserving the organization's history and contributions.
As we think about the next 4 years, when you'll mark your 100th anniversary, I think it would be good to have a formal documentation, meaning to have a book published on this remarkable organization. And so if we take some time over the next couple of years to do the research, I think for the 100th anniversary that you can have a beautiful publication that illustrates the history of nursing in Guyana.
The Health Minister further encouraged those who receive bursary awards to start thinking about their future careers.
So I want you young people, you're getting these bursaries today, you're being appreciated by the Nursing Association. You have a bright future ahead of you. And I want you to harness that future, make good of your education, learn as much as you can, because there are lots of opportunities that are now available for training.
In closing, Minister Anthony disclosed that starting next year, the ministry will be rolling out the electronic health record system, and as such, they will be working closely with the Nursing Association and nurses to adopt this initiative. This has brought us to the end of this Week in Review. Remember to visit your nearest distribution site and take advantage of the Ministry of Health Eye Testing and Spectacles voucher. The eye testing vouchers, valued at $2,000 Guyana, are being utilized by senior citizens and children. Should they require spectacles, an additional voucher valued at $15,000 Guyana will be provided to offset the costs. Until next time, stay well.
My name is Donald Clark. I'm from the East Coast. Well, I think it's a good voucher. It's giving back to the citizens of Guyana, and it's on the whole for us elderlies and even for the children, it is good. So it's a good voucher.
I think it's a wonderful initiative. I just finished getting my eye tested, and I just learned that I kind of going blind in one side eye. So it's a good initiative, because if I didn't come here today and I didn't come here and do the eye test, I want to know that the eyesight going in one eye. So I think it's a very good initiative, and it also helping persons that may not be, financially able to. So yeah, it's a lovely initiative. I would tell them to go to their nearest health center, or they could even come down to the Building Expo and access this, because it's a very lovely initiative.